Good evening, everyone. I'm Dr. Yvonne Chase, President of NASW, and I'm so glad you could join me tonight or this afternoon, depending on where you are in the country. Our topic today is urgent and deeply important: rising authoritarianism and the crackdown on homelessness. We are seeing troubling signs across our country every day. National Guardsmen are at our nation's capital and are threatening to be in other parts of the country as well. There are reports that migrants are being detained without due process. Deportations are happening without fair hearings. Trump, in an executive order, has called for people who are unhoused to be cleared from the streets. They're being treated as a public threat rather than as human beings who deserve dignity, rights, and compassion. Tonight, we're going to explore this topic and explore what it means for our profession, for our clients, and for the communities we serve. And most importantly, we'll talk about how social workers can respond. I am joined by three incredible guests and welcome each of them, although I do see that one is having difficulties with the internet and has just dropped off on us. But I'm
Okay.
going to introduce all three anyway. So, first we have NASW Senior Policy Advisor Mel Wilson. We have Emily Kennedy from the Milwaukee County Department of Health and Human Services. And we have Dr. Victor Manalo from California State University, Los Angeles. And I'm hoping that Dr. Manalo will be able to reconnect. He was on a second ago. So let's hope that the internet comes back for him. So, thank you all for joining me this evening for our conversation. And to start us off, I'd like to ask each of you a question. So, the first question is, how do you see some of those executive orders and the authority um, uh, aspects showing up in your community and work? And how is it affecting people who are homelessness and or are at the risk of being homeless? Emily, you want to start us off?
Sure, I can. Thanks for having me be a part of this. This is amazing. I started my career, my social work career, as a street outreach worker in Milwaukee. That's where I still work. So I have it's near and dear to my heart to think about how we are systemically figuring out how we solve the problem of homelessness. And so, as with many of the executive orders that have come out, the actions aren't here yet, if that makes sense. So the effect that it's having, I think, on our workforce is a lot of anxiety. There's a lot of unknowns about what does this mean and how will it be enforced and will we implement, how will we need to implement any of the things in that order. But it is an executive order. It's not something where there's a regulation yet or it's yet tied to any funding. So in terms of our policies and the way that we're interacting with people experiencing homelessness, we have not changed anything yet, and we are not we're not mandated to yet. So that order was a kind of a we encourage this. We urge you to look at these policies and change the way that you do things, but there was nothing mandating that. So what we're seeing is a lot of anxiety and unknown, but we are current state, steady state, continuing to work with all the best practices that we know that that work, and we're going to keep doing that as much as we possibly can.
Thank you. And Dr. Manalo, I introduced you in absentia and told them that you would be back soon. So I'll
And
go.
I'm back.
Wonderful. So the question that I threw out, and I'll ask Mel to address it and give you a moment since you just rejoined us. But it's how do you see this authority approach in your working community, and how is it affecting people who are homelessness or at risk of being homeless?
Yeah, like Emily, I have a long history of working with homeless populations going way back when with healthcare for the homeless. It goes back over 30 years. And my biggest concern, I'm here in DC, so therefore was very, very up close to what happened with the executive order and how it impacted DC. My biggest concern is the criminalization of homelessness. If you read the executive order and read some of the statements by President Trump, it really was a very demeaning approach to it. The description of almost seeing them as less than, and not focus at all on services, but more on policing. If you don't do X, Y, Z, if you're not off the street in 5 minutes, you're going to jail. And that is totally criminalization of homelessness. And all of us, whoever works with this population, knows that intersection of jails and in and out for folks, especially those with substance use disorders and in particular serious mental illness. So I think the executive order is a mean document. It is, there is a direct impact in DC, and so it's real. And I think the message is that this is real. This is something that they're going to certainly try in other cities, and it is a total disregard, an almost inhumane approach to the notion of being unhoused and who it impacts. And if folks recall, there was the administration pulled funds from the District of Columbia for some of the services. So it was kind of insidious in its kind of callousness. So I do have strong feelings, obviously, that's a problematic executive order.
Thank you. Victor, I know that you have been a councilman and a mayor in former life. Add some comments here.
Yeah, since I lost my reelection in 2018, I tell social workers in particular that I'm a recovering elected official. So, but I still remain very active in local government here in Los Angeles, and I think the question of homelessness really here in Los Angeles, we're dealing with it on our own. And I don't think nothing that has happened over the last 9 months or so has really had any effect. It's had some effect on some of our, and not yet, but there's, we're all wondering and waiting and bracing, and some of our major departments here, like the Department of Mental Health, the Department of Public Health, are looking at how those cuts are going to affect us, and we know that they are, but we don't have anything in particular, any details at this point. But about 20 years ago, we passed in the state of California, we passed a law which put a 1% tax on millionaires and to fund our Mental Health Services Act. And so we've had a lot of investment into mental health over the past 20 years. And this 2 years ago, the voters passed a proposition to actually update the Mental Health Services Act. So now it's called the Behavioral Health Services Act, still funded by 1% tax on millionaires. Wow. And we are now bringing together the mental health and behavioral health services together with a very primary focus on homelessness, because we know that many folks who are, the ones who are chronically homeless, struggling with homelessness, are those that have substance abuse and or mental health issues. So we are actually in transition right now in LA County. And I think, in LA County is kind of an anomaly as we are compared to the rest of the United States, because we have 10 million people in LA County. And that's more than 40 states in the United States. So we're a county infrastructure dealing with 10 million people. And so it's quite we pretty much are trying to forge our own way when it comes to But it's a big problem, and we're trying to figure it out as best as we can.
Well, I think I'm on the other end of the spectrum in terms of population size, since here in Alaska, we have yet to hit the 1 million mark, but we do have more moose than people, so I guess that counts. Let's go on to another question. Although I'm very interested in that 1% tax on millionaires. I don't know we would find that many in other states, but I'm curious as to whether or not that might be a way to address this as we see these executive orders actually take effect. So I guess, go ahead, Emily. You look like you had a comment.
Yeah, I was just going to say that I think one of the things to keep in mind here is that our response around homelessness is hyperlocal. It has always been meant to be that way. Yes, the funding vastly comes from the federal government, but the way that we think about how to solve homelessness, our infrastructure, the way we set those things up, that is local. And I think leaning into that, and Dr. Manalo, you kind of, in LA, you're having to do it, but if we can embrace that, we're thinking about that in Milwaukee County. What are we going to do? Because kind of regardless of what the policies are, we know that we are still responsible for all of the people within the county. Mm-hmm. And so we need to come up with our own responses, kind of regardless of the funding that we may get or not from the federal government, the kind of mandates that come down, preparing to be stronger together locally. And I think that that's something that we can all, as social workers, think about and keep in mind and advocate in our local communities. Advocating at the federal level is 100% needed. And how can we advocate for specific actions locally that will brace each community for any changes coming?
Dr. Chase, can I add something there?
Certainly.
Really, really good point about being local, because I can speak from that national perspective, and we go into the reconciliation budget for that, the issue on Medicaid and homelessness. And real good point where locally there's some funds that certainly that LA and Milwaukee can find to help maintain services. But with the drastic, crazy cuts to Medicaid, everybody's going to be impacted. And that came out of an executive order, obviously, also. And in looking at homelessness within that context, there was a total disregard for certainly past experiences and successes in local localities, and at least managing homelessness to turning their backs on it. So that's something we just can't lose sight on, that national piece. And it's there now. This is not something that we're projecting. There's impact. I mean, it's not going to be maybe more, maybe a little bit less, but there is an impact, right? That national piece, and we do have to stay mobilized to fight that piece too. And all kudos goes to the local jurisdictions that are able to maintain.
Yeah. Okay. Well, and I think and I don't want to jump ahead too much, but I think the executive order is one piece. The second piece that we're monitoring right now is around it's called COC, the homelessness dollars that come out of HUD. That funding, that grant, which in years past has been, it was very stable. We could count on it. That's definitely the way that HUD has announced its policies. So, for example, it said, several years ago, you got to figure out how to do housing first. Everyone's got to figure out how to do housing first. And you local groups, you need to tell us, HUD, how you are going to implement housing first. And the better that you do that, the more money you get, and so it's really a mechanism for HUD. It has always been a mechanism for HUD to enforce its policy recommendations. There is word that they will be releasing the next COC grant. It has not been yet. And so what that entails, I think there's some valid concern is too light of a word around that, because there was a second one. I'm getting into the weeds here, but there was one that was specific to being able to build infrastructure for housing. that has been released 3 times. It was released once pre-Trump administration, and it's been re-released twice since, without any announcements made about who got those awards. This 3rd release had a week turnaround and had a very clear instructions that you just needed to check the boxes that you would agree that any participants using this money would, there was the list that mirrored the executive order around mandating treatment and, making sure that that they were U.S. citizens and all the things that have been priority for this administration. And that made it unavailable for a lot of communities because they can't say that. They can't say, yes, we will do those things. And so that executive order, and Mel, this is, I think, what you're getting to, paired with, that doesn't mandate anything yet, but paired with the upcoming grant application, if that application looks the same as this littler one that they just re-released, that is going to have, significant impacts across the country for our funding for this.
Any follow-up comments from Victor or Mel before I go on to the next question?
Yeah, Dr. Chase, thank you. I just wanted to add, to what Emily was saying earlier about, kind of hyper-localness of the provision of services, because that's, I think, even the nonprofits, faith-based communities, those in our local neighborhoods and communities are all looking for ways to fund. And they know that they're not getting it from the feds anymore, and they're not going to get it for the next 3 years. So we can't wait another 3 years for favorable administration. There are crises and needs that need to be attended now, and it's interesting because they're all looking at, a lot of nonprofits they're pivoting on their strategic plans, and they're looking at their mission statements, and they're looking at how to coordinate with each other and not compete, right? Because the limited funding available to nonprofits caused nonprofits to compete with each other as opposed to cooperate with each other. And now people are talking about the silos that they've been in and the need to break out of those silos. So I think there's a lot of thinking and innovation and strategizing going on in our local communities. And as Emily, I think she referred to it or acknowledged it, right? That's what we should be doing as social workers. We're the ones that are working with the clients in their neighborhoods and communities. And so we need to be that bridge between the money coming from the state or the county or wherever it's coming from, making sure that these communities that actually need those services, need the housing, need the mental services or substance abuse services, are actually getting those services. And I think a lot of us on the ground are kind of looking at this as opportunity to kind of retool our business model and how we're actually getting these services out to the community.
That's an excellent point, and it moves us right into my next question, which is, what kind of practical and ethical dilemmas do you think that social workers will face when these are enforced, when encampments are being cleared without adequate housing alternatives? Anyone?
I can start. So I think that those kinds of ethical concerns have always been present, and it's going to be heightened. I was this was when I was a young social worker. I was in a continuing education class that really challenged me. This was about a different system. This is about the child welfare system. But the speaker said, you've really got to think about like how you show up and how you are contributing to the systemic inequities that exist. And that I think about that all the time. And I think about that in this context. So I think for social workers, we have an ethical responsibility to do what is right and what we know works, even in the face of even if that's against the rules, even if that's against the mandates. And so we need to be prepared to maybe change the way that we do our work. We need to be prepared to stand up and say this isn't right, and that that might not be something that we have to do today, but some people have. There are some communities where encampment sweeps have been really regular, and that's just going to be more widespread. We need to know and stand our ground that housing first works. Housing is the solution. And whether you're in the housing field or not, we need all social workers to keep beating that drum and stand up when you see that something unethical is happening, even if it's against the rules.
Right. Mel.
Yeah, again, I'll speak from more of a national, not necessarily a direct care point of view. I think that certainly there is an ethical dilemma simply because of impact, and we know the impact is going to be disparate, and the impact didn't have to happen. So therefore, we see that as the government doing something that's harmful to folks that we certainly work with. I use DC again, the authoritarian move made in DC, and there was a big march a couple of weeks ago that really argued obviously against the executive order, and homelessness was part of that struggle. And I was out there, and I was happy to know that there was a social work contingency out there. My point being that on these national things, we need to get out there. We have, and that could be done from a local and a national standpoint. As most of you all know, that a lot of the fight against some of the authoritarianism is really pushing out more to local communities, getting very directly involved with things that do challenge our social work ethics, and certainly this issue of homelessness and issue of authoritarianism does challenge that. So that's my feeling, that social workers, even though if you're doing direct care, that doesn't preclude you from not getting out there and saying, okay, there needs to be a policy change, there needs to be a different approach to this, and you're hurting folks that are vulnerable. And I think that's one of the things that we should really always push.
Victor, want to add?
Yeah, thank you. Yeah, having been on the city council for about 12 years here in the outside of Los Angeles, a small little city, but there are a small city where I live, but there are in Los Angeles County, as I mentioned earlier, 10 million people in LA County, and in LA County there are 88 cities. So you have a city as big as Los Angeles, which is a few million people, and you have a city like mine, which is 17,000 people. So there are a lot of different entities to deal with in this particular county, different cities and subdivisions in the county. But one thing that has happened here, especially in regards to homelessness, is how when I was on the city council, people, not specifically in my city, would complain because we're small and we don't have that many visibly homeless people. But in other cities where I have fellow council people that I know in other cities, their cities are receiving complaints all the time about people that are, setting up in the park, trash, and the Department of Public Health is saying, this is a health hazard, right, for people to be staying out in the parks. And so what I took from that is that there are many sides to the story here, right? I mean, we want people who are unhoused to be dealt with in a compassionate manner. But you have people, I can't say that, a homeowner who's complaining about people setting up tents across the street from their house don't have a valid complaint, right? And they can't do anything about it. So they're going to call the city because they think the city's going to do something about it. And the city then has to has to do it. And unfortunately, cities are thinking, what's the most expedient way we can do this? And that is to call law enforcement and then just sweep them up and move them out and try to, move them somewhere else. But I think we have a role, as as my colleagues have already stated, we have a role as social workers to step up, right? That we can be involved in that process. Now, I was a social worker who was a council person, but that doesn't mean that if you're a social worker that lives in that neighborhood, that you can't stand up and say, listen, I'm a social worker. I know what it's, even whether you have any experience working with homeless people or not, you can say, I want to help. I want to help in your response, right? You can't just take this person's possessions, throw them in the trash, and handcuff them and take them off and put them in jail, right? So there is opportunities for us to do something, right? We don't have to just lament and stay silent about things that are going on. We have the skills to be a part of changing that process if we see that it is a process that is being disrespectful of people and we're not attending to their basic rights as human beings. And I think that's very important for us to know. So no matter where you're at, there's a place for us, right, to stand up and to say we want to help and we want to be a part of the process.
Really quickly, there's a picking up on Victor, the idea of public safety, and there is certainly models now expanding that definition of public safety to what you're raised with, where someone who is unhoused but doing things that are not, of course, murders or major crimes, that the concept of community safety is that is part of public safety along with policing. So and when cities, jurisdictions, and the feds start doing modeling, they need to see it in that broader context. So it gives you much more ability to have interventions that are clinical, health-wise, also recognizing that there are times where someone who's so far out of the norm that there needs to be some police involvement. But I think we should embrace those kinds of models. And there's a coalition working out of DC that's really looking at it from that standpoint, because I think that starts to address some of the things that you raised, Victor.
Before we continue, let me just let the audience know, I know we're getting a number of questions coming in, and we will take some time at the end of the hour, before the end of the hour, last 15 minutes or so, to try to address those questions. So I don't want the audience to think that we're ignoring that. But when we talk about, I guess I'm going back to perhaps Victor's comment earlier about behavioral health and mental health issues. And it seems, sometimes I know that housing is obviously a critical need as we look at the initial needs of someone who's homeless. But sometimes I think we forget that there are also the mental health and physical health issues that people have. And I've seen individuals released from psychiatric facilities without sufficient medications, and or a physical health facility, a hospital, without a supply of insulin that they need. So as we look at the dilemma, I guess, of individuals who are living on the streets, it becomes more complex, I guess, is my point. Yeah. So how do we go ahead, Emily?
If I could just respond to that, it is complex, and it's really very simple. So at the same time, and I think the executive order, I want people to really when you I hope everyone has read through it, and the language is very clever. It is meant to make you feel like, oh yeah, this is a benevolent thing. This is a benevolent thing. This is something that, yes, people who are experiencing homelessness and are outside, they must be struggling with something. And it even quotes in there the statistics of how many people, especially people who are outside, are there's a majority of them are struggling with some kind of mental health or substance use disorder. That's true. The solution that is proposed, though, so pay attention to the solution. They phrase the problem as this is something that we need to do something about. And the solution is to take away people's rights and to lock them up, to mandate that they get help. Not necessarily help, treatment of some sort, right? And what that looks like is some kind of locked facility where they are away from the community. And they mention public health. This is for public health. This is to keep crime off the streets. It's all like wrapped up in this package that makes it seem like we're really trying to solve the problem. If we want to solve the problem, though, we know as social workers, and it's not even social workers, there is a plethora of evidence that says if you want to solve the problem of people who are outside and don't have a home, of people that are the public safety issue, and it's true, encampments can be a public safety issue in terms of the way that they are forced to live because there are not facilities and things like that there, and generally anyway. And so, but the way that you solve that, the way that you solve crime, we know that crime goes down when people are housed. The people that have gotten tickets, they get fewer tickets once they're housed. So the solution that we know works is to focus on housing. And the good news is that it's also cheaper. So this proposal to incarcerate people or lock people up is far more expensive than focusing on what we know works, and that the solution that includes, human dignity and self-worth, right, which are our values. That solution is cheaper and more effective. The proposed policy in this executive order will not work for what they say that they are going to do. It's not going to work.
Mel or Victor, a response or comment addition to that?
I totally agree. I mean, it's what I was saying earlier, that choice of jail, and that wasn't the executive order. That's really the bottom line in that executive. And what happened in DC too is that it increased the capacity of either if they go to shelters over capacity, if they're forced in it, just all of a sudden, or if they go to jail, there's no services and there's no transition services there. As we all know, that's the model, is that even in a jail situation, you have a chance to, at least for medication, to transition folks out or find alternatives. And none of that is structured in the executive order. The executive order thinks nothing about the comprehensive kind of care that's needed. And I agree with Emily, this is not new. This has been around for a long time as far as how to go about doing this. So I totally agree with what Emily said.
Yeah, I just wanted to add to that what Mel said, that this is not new. I mean, I've been a social worker since I graduated from Marquette University with my bachelor's degree in social work for almost
Milwaukee connection.
For over 40 years. Right. It happened. And, I was old enough. It happened in 1980 when Ronald Reagan was elected, and everybody said, oh, my God, Ronald Reagan. Oh, my God, what are we going to do? Right. Everyone was freaking out. And so there have been even presidents that we thought were friendly to us. Right. We were still out there in the streets having to deal with crises and unintended consequences and lack of access to services and lack of community investment. This is not new, right? As social workers, we have been fighting this fight for a long time. It just kind of goes like this, right? Sometimes it's easier, sometimes it's harder, sometimes we have to pivot and figure out new ways to do things. And that's c'est la vie, right? I think that's how life works, and we're not immune to that as social workers. But I think, getting back to your question, Dr. Chase, and to comment on what my colleagues have already stated, is that I think that the the issues need to be brought to the local level, which I said earlier. I think that's the most important thing. I mean, thank you, Emily, for asking me to read the executive order, but I really don't. Somebody in private chat said it gave me a headache, and I said, I don't really want to read it. But you know, I'll take your word for it that it is not a solution. But the only thing I can really control right now is what I'm doing right now. I can't control what happened. I can't control an executive order that's going to come down, or any executive order that's going to come down between now and the next 3 years. There's nothing I can do about it. I hate to say it. I really hate to say that for myself, that there's nothing I can do about it. But what I can do is what's right in front of me. And those issues are not going to go away, whether there's another executive order coming next week or a bunch of them coming over the next year or so. I'm going to keep doing what I'm doing right now in the hopes that things will improve and get better. And if we don't have that hope, how are our clients that we're working with, how are we going to give them hope, right? That things are going to get better. Somebody's got to be with them, right? Someone's got to be on their side and holding their hands and walking with them and journeying with them and saying, listen, it's going to get better, right? It's going to get better if we work together.
Yeah. Well, Emily, I know you mentioned, it gets down to really where the rubber hits the road, so to speak, and at the local level in terms of finding various solutions in different locations. But given what's happening, what's the role for an organization like NASW, a national organization, in this whole dilemma?
Mm-hmm. I think of two primary roles right off the bat. The first is advocacy, of course.
Right.
And I think being that voice at the federal level and at the state level, I think is so important. States can make choices about how they're spending their dollars too. So we know that the federal money is going to be harder and harder and harder. What can states and counties and cities do to be able to try to close some of those gaps? I don't think they'll be closed completely, but advocating, NASW can help advocate for that the funding and the policies that we know work, and making sure that people on the ground have the resources. I think the second thing is like what we're doing today, educating social workers, because housing impacts every single section of social work. It doesn't matter what area you're in. Housing is like the biggest, social determinant of health. It shows up everywhere. And so I say this all the time, that housing matters to you no matter what type of social work you're in. And so NASW can play a role in making sure that social workers know about what's happening. There's so much to try to follow. So being able to distill down, here's what's happening with regard to housing, with regard to homelessness, and so that and you can help join the fight, as Dr. Manalo said, help join the fight when it comes to your community. And there's take action because it matters for you and your clients.
Good point. Mel?
Yeah, if anybody knows me, they'll know that I'm evangelical about coalitions. I as a national organization, it is an imperative that we don't see us as lone wolves trying to solve a problem as huge as this, and that we need to be a part of nationals and local coalitions. NASW currently national is very much involved. In fact, I was at a meeting this morning, Zoom meeting with the Coalition for Human Need, and this whole same conversation we're having now was had there, where there were 100 organizations in there, because it really gets into problem solving. We can't approach it as if this problem can't be, if not solved, certainly mitigated, or at least a defense against some of the things that are already happening. But it doesn't mean that we can't get out there and be a part of that struggle. It has to happen. There's no other choice, really.
Right.
This is not reversible unless it gets reversed. And that's more, and advocacy is great, but advocacy and activism, it should go hand in hand with this. And lastly, what I'll say, that there's an intersection with voting and everything we're talking about. The midterm elections are coming up less than a year now, I think. And if we want change, we really want to help protect the folks that we care about, that we work with, and the vulnerable populations, it's clear that there's some change that has to happen in Congress. It just has to happen, because this issue of authoritarianism is a planned, structured issue. Project 2025 laid it out. It's not a joke, and it's going to go forward. And so that fight against it, where NASW as a national organization should be a part of that fight. And you know, I don't think it's that much that we have to give just to be and just be involved, just making sure that our voice is heard. So I think that the two of those together, seeing it specifically where social work and the services that we do and those policies, but also that political piece of it that is really as critical as the rest of it is.
Thank you. Victor.
Yeah, I think that, you know, I think it's really important what Emily and Mel were talking about, and that is, you know, how you activate as a social worker. I think that's the most important thing. And there are thousands of things that you can do, right? I mean, and we've just barely scratched the surface on things that you can do. But I think what we need, there are a couple of things that come to mind. One, and I will plug NASW too, because I am a very active and engaged member of NASW, and I would not be, I just would not be in the place that I'm at right now if it weren't for an association that gave me that provides for me a community of like-minded people that can support each other at the very basic level, right? And that's more than just paying your dues, right? Because paying my dues is not going to make me feel like I'm part of a community of social workers.
Right.
It's getting out there and getting involved in your chapter, getting involved in your local units. It's about meeting people like Emily, and I've had the pleasure of working with and working for Dr. Chase as the president of NASW board. And I've met so many amazing social workers from around the country that when I get on a Zoom call with a bunch of social workers, it's like you can let down your hair and let down your guard and you can just let it out, right? It's like whatever's bothering you or whatever good is happening, because we understand each other, right, as professionals. And that goes a long way. So I definitely want to put in a plug for NASW. So get active, because you'll find ways to get involved, whether it's on the local level or at your state level. We have amazing staff that are doing wonderful things in their individual states, as well as across the association. So that would be my first plug. My second plug would be that, and I'm just going to put this out to Dr. Chase. We need to rebrand ourselves as social workers. We need a rebranding, because I think what we need to brand ourselves as, and you're the second person I've said this to today, that having a social work degree means you are a leader. It is a leadership degree. An MPA is a leadership degree, but that's for public administration, right? There are master's degrees and all sorts of things that are built in, like organizational leadership and development and all that stuff. I think having a degree in social work automatically means that you are a leader in the field that we are talking about, in the field of human services and social services and helping people. That's my plug, I think. And so my message to all of you that are here is that you're all leaders, right? And there's something that we can do, right? Whether you're the director, a director in a public social service agency, right? Or you're a faculty member or a director, or you're, whatever you're doing, you have the ability to be a leader and to have influence over some of these systems that we're all talking about that negatively impact us and impact our clients.
Thank you. Well, I want to open this up for questions that are coming in. And I see we've got individuals from all over the country here. And there's a question up there, but I have to tell you there was a statement that just came across before you finished talking, Victor, and it said, "You just woke up the activist in me." There you go, which has been dormant for a while. Okay, I'm going to ask for the first question to be back on the screen. So, where will the overflow be taken if the local shelters, beds, and churches are full? We all know there are not enough psych beds for people with insurance and resources. Will ICE be clearing the streets? And that is a question from Patty. Who would like to take Patty's question?
I can go ahead.
Emily. I think
Emily should take this.
Well, none of us have a crystal ball, but my fear is that that's where we're headed. Now that I see kind of the grant funding and that phrasing change, several weeks after the executive order came out, I think so. The executive order, what it really was saying at the end of it, its ask was to have states look at their policies around involuntary institutionalization of people, people in general, but saying, think about expanding your laws to include people experiencing homelessness as kind of like a reason to involuntarily detain somebody. And I don't have a crystal ball, but seeing these two things paired together and knowing what's happening with the militarization of our streets, I think that is what's coming. And I think that will be the rationale, saying, hey, we said local groups, we said states, think about changing the way that your laws work so that later there can be a comment. We asked you to do this and you didn't. So now we are taking over. So I think that that is part of what the local response needs to be. And I am not advocating that we involuntarily round people up. But I do think locally, states and counties need to think about, we started with the mental health response. We need to think about what that looks like. And I love that in LA, there's more connection than ever with behavioral health and homelessness. I think if those two systems can come together more strongly, then we'll be more prepared to react and to be able to resolve crises before other groups come in. I think it's possible, though, that's what we're headed toward, and we need to be ready to stand up to that.
It gets into a resource issue for us, because what Emily's saying is that executive order does read that way. And to the questioners, if they have the folks that it's an overflow, jails become a default again as the default mental health system, and that still exists to a large degree. But at least there was some attempt to transition. The impact of Medicaid being reduced to such a degree takes away resources for that kind. The executive order assumes that these services are out there, and folks just walk in, no waiting list, nothing, just go walk in, and then take away money that doesn't allow the communities to expand those services to deal with that overflow and absorb these folks. So I'm kind of pessimistic in a way that it winds up being jails again becoming the default mental health and inadequate transition out of that. So it becomes a vicious cycle.
Oh, Victor.
We can see the reality, and Emily talked about it. I mean, that there is if we can look down the way, we can see what could happen. And I would say to everyone that that's not set in stone, right? We can do something, even if it's something small, right? We'll be bending the arc and changing the direction. You can't change the direction of a yacht on a dime, right? It slowly turns. So if we can do something that just, can turn the yacht just a little bit off course, then we don't have to end up in that eventual position of having no place to put people, right? And no housing and nothing available for them. So, I've been working, throughout Los Angeles County over the last few years, and I just left a meeting today where, we're taking we're taking a public health approach, right? Like we're saying, I went to DCFS and I said, Department of Children and Family Services, Child Protective Services here in LA. And I went to an office, one of the offices. It wasn't that as simple. I'm just telling you the story, how it worked. But and I said, what is your problem zip code? And they said, here's the zip code. This is the zip code where we have the most hotline calls, and this is the zip code where we have the most cases and the most removal of children. I said, okay, then we have to start there, right? We have to start there in that zip code. And I just left a meeting earlier today with all of these faith-based organizations who say, hey, I live in that zip code. I want to do something. And people saying, I lived in that zip code and I work in that zip code and I want to do something, right? So it's about harnessing and convening the community, the people in the community that have these resources, because, Emily and the Department of Public Services, Social Services in Milwaukee can't do everything, right? They can't provide all the services. They can't provide the housing. They can't provide all that stuff. But there are people in our communities, in our neighborhoods, right, who have the resources, if we all brought them together for this common cause. So I think that works for housing. I'm working on another project to house 50 foster youth who are going to be unhoused in my part of Los Angeles County. 50. Now, it's not a lot, because there are going to be over 300 foster kids that are going to be emancipating from LA County system this year. But you know what? It's a start, right? It's a start, and it's a start that can be a model for other people to look at perhaps and say, hey, if they can do it, maybe we can do it, right? So we just have to do something. And if you need help, I'm sure all of us would be happy to help you figure out and to connect on what you could do.
Absolutely.
I see we had something from Heather up there. I think we have probably time for one more question. Heather's saying, as a student, I've been disheartened thinking about what lies before us professionally. This time with you all has been incredibly inspiring, helping to build my courage by remembering there is strength in numbers, and that standing by each other and our communities even more during these times is vital and powerful. Much appreciated. You couldn't have said it any better, Heather. That's it. That's exactly our point. Thank you.
Dr. Chase, if I could just build on what thank you so much for that comment, because the reality is, if, like I told you, the meeting I was at today, if you go out into the communities and talk to folks, there are people out there that are just as concerned about all these things as we are. They are just as concerned. They just don't happen to be social workers, right? They're just regular folk in their community, going to church, taking their kids to school, part of PTA, right? And teachers, all kinds of folks that are out there. Those, not just social workers we need to connect with, but we need to connect with people in their communities, because there are there are people that really do care about these same issues. And what we bring is, again, the leadership and the organization and the management, and to help make those things happen, right? Knowledge of policy and procedures and how agencies work. So we really have a lot that we can do if we get out into the communities and talk to people. There are a lot of people out there that that will join with us.
I agree. I see a question up from Jessica, and I think we've addressed a bit of this, but her point is that money's being funneled even more through the criminal justice system, and the jails are being built, bigger and larger jails. I'm adding a few words to your comment, Jessica. And they're, quote, adding rehabilitation services. That pivot point is essential right now, and we're moving backwards. What is the middle ground, or where is the middle ground? I think she might be asking. Who wants to take that?
I don't know if there's a middle ground. I think she
is there a middle ground?
Right. It's sad is it is like almost either or kind of a situation that it, even if rehabilitation is the intent of a jail, it's a resource issue. Again, it's overcrowding of the jails. This just has to be much more of a comprehensive, cohesive movement to mitigate and to change the direction things are going. Because I don't know, and there's a sort of another little intersection here in dealing with the issue of another executive order, which is the mass deportation order that intersects with all of this, including the jail. So we're dealing with a multi-headed animal, for lack of a better description. And so I wouldn't want to say something that sounds overly hopeful when I don't really feel. I think it's a really big challenge ahead of us.
I'm going to ask each of you for sort of a final comment. So, Emily, you were about to say something. I'll start with you.
I'll use this as my final comment. Thank you. So I would just encourage us. I know that we have to talk to people that have different belief systems, and so what I say, and I wonder if the comment was kind of getting toward that. The middle ground being, how do we talk to people who are more conservative about this issue? And what I would say is, for all issues, think about what problem you're trying to solve and find a solution that does that. We know that incarceration of people, inpatient treatment for people does not solve homelessness. Neither, by the way, does shelter, right? It's a step. It's a safety piece, but it's not going to solve homelessness. So if what we want, and I think that we all agree on this, if what we want is for people to be off of the streets, for people to be self-sufficient and contributing members of society, the way, and healthy, we could maybe disagree on that, but the way that we do that is by providing ample housing and supporting people in housing. And that's what the research shows. So think about the problem that you're trying to solve rationally and find a solution that actually solves it.
Thank you. Mel, a final comment?
No, I just thank you for inviting me. I think we had a good and very serious, this is a very serious discussion for social workers and the entire society. I guess my final comment is what I said earlier. We do have to mobilize. We have to be out there. We can't shrink away from this. It won't allow us to shrink away from this. And the history of social work as a profession and our ethics dictate that we stay involved and do what we can do.
Victor?
Thank you, Dr. Chase. I mean, I think I used my final comment earlier when Glennie said I reactivated the activist in her. So I should have dropped the mic at that point. But I will say, I mean, to end here, I'll put one more thing, one more thought out there, and this is something I'm very passionate about. Having served as an elected official on the local level, the more of us social workers that are active in government at whatever level of government you want, the more social workers that are there and actively engaged, the more people, like clients that we serve, the more that they're going to get listened to. And the more of us that are actively involved and the more clients and communities that are being listened to at those levels of government, the more social justice there will be and the more access to services there will be, right? So if you're interested and are thinking about, if you ever even thought about running for elected office, come talk to me and I'll help you. I'll help you because we need more social workers actively in government.
Absolutely. I definitely agree. Well, in this last minute, let me first say thank you to all three of you. Wonderful comments, important comments. And I have to tell you what I heard from each one of you, among other things. From Emily, reminded us to remember to look at the local level. These are where the things are happening and going to happen. Mel, I think you were the one that said, remember there's advocacy and there's activism. And we have to think about both. And Victor, you couldn't be more right on about we need more social workers getting involved in government. It's not having them tell us. We need to be up there as a part of that. And I agree. We need a rebranding. We will have a board meeting next week, and I will talk to the board about a rebranding. I usually tell my students to remember that out of chaos comes creativity. And we have seen some things come out as a result of some of the absurd things that have happened in our history in every administration. So don't lose hope. Carry the good fight. And thank you all for participating. Hope to see you next month in another chat.
Thank you very much.
Thank you.
Thanks for having me.
Thank you.
Thank you.